Hello, everybody. This is Dr. Shana Clark, and this is the next installment of my book, Ask, or of my show, Ask Dr. D-O-C-T-O-R, Shana. And if you want to ask me a question, you can go on my website, which is Dr. D-O-C-T-O-R, Shana, S-H-A-N-A, .net, and put the question there. And I check my website every week uh, to plan to answer any questions that appear there. The only thing that I will tell you is that I'm not going to be telling you specifically what kind of therapy you should have or what kind of meds you should be on, because I will have had just one short contact with you, and your provider knows you much better than that. So it would be dangerous for me to start speculating when your provider knows you well. However, anybody who wants help communicating with their provider, as for example, they have a side effect which to some people might not be bothersome, but to them it is, and I'll give you an example. A slightly overweight middle-aged man might not mind putting on a few pounds, but a young girl who is slender and attractive would very much resent putting on weight and might even stop taking her medication because of that. And I have encountered psychiatrists, particularly men, who don't understand that staying slim is very important for a young lady. So I can help you with that sort of problem if you like. I will say, as I have said also before, that if something dramatic happens to you, for example, I had one patient who fell asleep on the way home one day, but she didn't tell her doctor she fell asleep at the wheel. She just said that the medication made me sleepy, and since 70% of the patients who take this medication, at least at the beginning, feel sleepy, he didn't think that that was anything to remark. But she didn't tell him straight out. Oh, our topic for today is more about anxiety. I did mention that there are several kinds of anxiety, and that it is the most common complaint among American patients that they go to see a doctor for. Try not to fall into the trap of thinking of if onlys. If only I had seen that red light. If only I had paid attention to that red light. If only I had noticed the car that was coming across the median. If onlys will achieve nothing for you except to sort of beat you up emotionally for your shortcomings. It is wise to say that you won't fall into the same trap of not paying attention in the future, but having said that, let go. Just don't go there anymore. And then for anxious people, there are the what ifs. I'm going for a job interview. What if I'm late? Or what if he asks me the one question I don't want him to ask me? For the latter, be prepared for anything the person might ask you. Don't have a I hope he doesn't ask me that kind of question, because it'll make you nervous and you won't present as your best. Have all those set ahead of time, and try to tell the truth, because the truth fits together, all the facts fit together, and whereas telling a lie means you have to remember that you told that lie, and it'll get you into more difficulties. Plus, if your employer is bright enough to catch on that you lied, he probably wouldn't appreciate that and might not hire you for that reason. But may I point out that most of the things we dread, the what ifs, are things that don't happen at all. What bothers us are things that we never thought might happen. And lo and behold, they did. Develop a technique for calming yourself down. And it's best if you can just think this and don't need to say it aloud, because if you're waiting to see the big boss and you start talking, it looks a little odd. So try and do it by thinking. And don't worry about unlikely things. I mean, don't be sitting in Arizona and wondering what you would do if an avalanche came along. There's no snow in Arizona, so that's not a current problem. And you would be surprised what silly things with when they're devoted to worrying. It's best to think that you have concerns and that you're trying to do some things, but not that you're worried. Don't cook up situations which are very unlikely to happen, but which have you shaking with nerves. I've seen too many people do it. Now, there is a particular anxiety called panic disorder, in which a person, based on some trigger, suddenly feels so anxious that they have even chest pain and they think they may be dying. Panic is not real. Um, I would recommend not driving or operating potentially dangerous machinery if you're feeling extremely anxious. Uh, get someone to help you, take a cab, do whatever you need to do. But there are times when a person is so anxious, they shouldn't be behind the wheel because you're paying attention to your anxiety rather than to all the things around you. And we often say, take deep breaths and slow down. Even if you're late by 2 minutes, most people won't hold that against you. We all know life is life, and there are all sorts of interruptions and unexpected things that might happen. If you're very worried about being late for something, set out 15 minutes or half an hour early, and then you can say to yourself, it's early. I don't have to worry about being late. But most of the things that are really bothersome are things that we never expected. And the question is to keep your cool even when something truly unexpected happens. I had a situation when I had a fire in my place that it took a very long time because the homeowners association would not hire a contractor. So it took 13 months for me to get back. And I made an agreement with a hotel manager that for a reduced price, considering I was expecting to stay there quite a while, but when the owner came back from a business trip, he reneged on the deal, but nobody told me. So when I was back in my place, I got a bill from the people that contract with my insurance to find temporary housing for people who are out of the house because of a fire or some other natural disaster. And they wanted me to pay $6,000, which I thought was a bit much considering that nobody had told me at the time that the motel owner had reneged on the deal. And I stayed in what was frankly a roach-infested motel because I thought I was living very cheaply. Well, I called my lawyer and he straightened things out. Unfortunately, it took him a little while, and so it was reported to the credit card, the people that give you your credit score, and I lost 100 points, which I won't be able to get back until 2023. Since I had a credit score of over 800 to start with, it's still over 700, so I'm not really in a difficulty there. But the thing is to just say, okay, this will be straightened out one way or another, and live the rest of your life calmly. Don't let a worry about one particular thing invade your whole existence and poison it. don't go in for worrying and fussing. Try to teach yourself to remain calm. As I said before, some of the most modern antidepressants are also used for the treatment of anxiety, and there are certain medications of the same classes of Valium that are also used against anxiety. What I didn't say was that if, for example, you are told to take an Ativan, one in the morning and one at night, if every third day you only take one for that day, then you won't get addicted to having two. And this could save you quite a lot of grief. Now, you can look at your calendar and say, which of the next 3 days is the least difficult, and that's the day I'll take only one pill. And if you're prescribed higher dose, always think of taking 3 a day, 2 days out of 3, and 2 a day the third day, because that way you won't become addicted to the 3, and you won't be asking, because if you take a dose for a very long time, it becomes less effective. You won't be asking your doctor for 4 or 5, which is very difficult for the doctor to give you, particularly because of the way that controlled substances, which is anything potentially addictive, are controlled these days. The prescriber has to be able to give a reason as to why they raise the dose beyond a certain level. And simply saying, well, the person is very anxious, is not a good answer. I think I mentioned last time, there was a man who came to me with the local paper's article about how his house burned down and the police report. And because of that, I was able to give him a prescription to replace the pills that he had lost. If he hadn't had that verification or the proof that his house indeed had burned down, I wouldn't have been able to do that. And it's always better to stick with a lower dose of something potentially addictive. So if you take one less pill than what is prescribed every third day, you won't get totally habituated and eventually addicted to that dose of all the pills. Whereas if you take any number of addictive pills every day, you will eventually get at least, let's say 95% of people will eventually get addicted to that one. I don't like medications like Valium much because they fuddle up your thinking. And if you really have a difficult situation that you're dealing with, you need to be able to think clearly. So let's say I had a patient who was driving the car, and in the passenger seat was her mother, and they had an accident, and She survived with a couple of scratches, and her mother was killed. So I gave her the addictive pills for maybe 10 days. And then I said, you're going to have to do without them because I don't want you to become addicted to them. So, and you can always ask your doctor if what he's giving you is either habit forming or addictive. Habit forming is a sort of psychological, oh, I need my pill thing, whereas addiction is really a chemical distortion such that your brain and your body are clamoring for the pill. Okay. Now, I'm really hoping that somebody will write me a question. Let's see, for next week's time, I will tape something about how to stay yourself if you have rather nasty and manipulative relatives, how to negotiate that situation. So until then, I do look at my website, which is Dr. D-O-C-T-O-R, Shana, SHANA.net, to see if anybody has posed me a question. And by the way, I would appreciate it if you would sign it with your first name and the first letter of your last name so that I would know whom I'm talking to if there happen to be two people of the same first name who write me on the same day. So I hope you're enjoying the summertime, and I will see you next week. Bye-bye.